Hi, Dr. Lucky Seacon, and I'm a fertility expert, OBGYN, based at a large fertility practice in New York City. And I want to address this comment on my most recent video giving an overview of the 5 most important things I think you need to know before starting IVF treatment. Someone was commenting on my point about the timeline being about 3 months, and that's if everything goes completely smoothly from start to finish, starting your injections for stimulating the ovaries all the way up to when you're discharged between 8 to 9 weeks of pregnancy to your OB. So this comment said with all the testing and scheduling, it's actually more like 6 to 7 months. I don't think that that's true. I would say usually I mentally prepare patients, and of course it's going to depend on your clinic, and it's also going to depend on your sense of urgency and how quickly and how motivated you are to get your testing done, and also where you live. If you're getting tests done like an HSG to see if your tubes are open or the shape of your uterine cavity, there may be waiting lists in certain parts of the country, but in a place like New York City, you can generally speaking get all the testing done and get set up to start your IVF cycle within a month. And the main rate limiting factor in getting your test results back before you can start is something called genetic testing. So carrier screening is often done on prospective parents, so both patients, or if I'm treating a patient who wants to be a single parent by choice, I'm at least doing genetic testing on them so they can choose a donor that doesn't have the same mutations. Or if I'm testing a couple, I'm going to test both of their genetics so that I can see if there's any chance that there's any sort of crossover or a match between mutations that both members of the couple carry, because then that might change how I would test their embryos if they're going through the process of IVF using PGT to test the embryos genetically. So that testing can sometimes take 3 to 4 weeks to come back. So that's usually the rate limiting step. All the other tests take much less time. Usually it's mainly blood work to check your AMH level to see what your egg count is, and that helps us figure out the right dose and protocol to use to stimulate the ovaries. A semen analysis, because we never want to be surprised on the day of the egg retrieval about the sperm quality, and men are always making new sperm every 72 days, so there's always room for improving the quality in the lead up to the actual retrieval and insemination of the eggs. Other testing that we do is looking at the uterine cavity, or a combination of looking at the uterine cavity and looking at whether the tubes are blocked or damaged in any way. And this can be done in a variety of ways. We do saline sonograms, we do HSG, and a lot of people might not be aware that you can do this uterine cavity imaging while you're going through the process of stimulating the ovaries. If the plan is to extract the eggs, turn them into embryos, and freeze them, it doesn't really matter if we're doing something like putting fluid into the uterus during that process to get diagnostic information about the uterine cavity. So that can be a time saver, so that you're not finishing the egg retrieval and then finally ready to do the transfer, but now pausing to do a uterine cavity assessment. If we find something on the saline sonogram or on the HSG that shows us you need an intervention, like a hysteroscopy to remove a fibroid or a polyp, of course that's going to extend your timeline, because those are the types of things we want to take care of and make the uterine cavity as perfect as possible before we move on to the next step, which is the embryo transfer. But I would say it is important to know that I think 6 to 7 months is a lot of lead up time, and there's no testing or anything that I can think of that would lead to that sort of delay. So if you're concerned about, time adding up, and obviously fertility is a very time sensitive issue, I think it's always important to speak to your doctor, speak to your clinic, and have a really clear idea of a realistic timeline. Anytime you're getting tests done, ask about what is the expected turnaround time to get these results, and will these results necessarily have to hold me up from at least going through the first part of the process, which is the most time sensitive, stimulating the ovaries and extracting eggs to try to make embryos. So these are all really important tips and strategies to think about when you're planning out the timeline and trying to fit IVF into your life.